Healing of ligaments or tendons with the application of stem cells. What is a stem cells? Stem cells are cells whose main characteristic is the ability of differentiate into several different cell types, giving rise to different tissues. There are three main types of stem cells. Embryonic stem cells, they are pluripotent, which means that they can become any cell type in the adult body. They are highly prolific. Adult stem cells, they have lower proliferative capacity than embryonic cells. Induced pluripotent stem cells fully differentiate adult cells that are induced back to pluripotency by cells reprogramming.
Embryonic stem cells will differentiate into endoderm, which gives rise to many internal organs, mesoderm, which gives rise to bones, cartilage, tendons, ligaments, ectoderm, which gives rise to neurons, outer layers of skin, and hair.
The mesodermal lineage produces mesenchymal stem cells, which are cells used in therapy. Mesenchymal stem cells are multipotent cells, which are able of self-renewal and differentiation. They ensure the tissue hemostasis through permanent renewal. Where are stem cells collect? Stem cells are usually collected from two main areas: bone marrow from the femur in dogs and cats, and from the sternum in horses. Adipose tissue from the inguinal region in carnivore, and from the dorsal surface of the buttock in horses. However, stem cells are preferentially extracted from adipose tissue. After collection, the sample undergoes several stages of digestion and successive mechanical and chemical separation. After a few hours, the vascular stroma fraction is obtained, which contains concentrated mesenchymal stem cells. Platelet-rich plasma is often used in combination with stem cells to amplify their efficacy. Plasma rich in growth factor is a type of platelet-rich plasma. The patient's stem cells are then injected directly into the affected area. The treatment may require one or several injections, depending on the lesion. What are the clinical applications for ligament or tendon healing using stem cells? Stem cells therapy in tendon and ligament is commonly used in dogs for cruciate ligament rupture or ligament or tendon injury in sport horses.
In study, partial cranial cruciate ligament rupture were treated in 36 dogs with a combined stem cells and platelet-rich in plasma therapy. In this study, there were both athletic dogs and house dogs. Most of cases, the dogs were able to play sports shortly after the treatment. These results have shown the efficacy of this treatment in case of partial cruciate ligament rupture. Between 2003 and 2008, positive results in response of mesenchymal stem cells treatment have been demonstrated in sport horses with suspensory ligament injuries. No systemic adverse effects were reported. In addition to having proven efficacy with no adverse effects, stem cell therapy works regardless of age or extent of the injury, which gives hope for winter use of this regenerative technique in other clinical applications.